This theme is an emerging issue in terms of medicine. The number of publications and good scientific journals is increasing a lot. And we have not, as we will see, a lot of good papers, a good lot of evidence. We are working and do it better. And this is Albert Einstein Hospital. This is a Jewish hospital in Sao Paulo, and I am Arab. My grandfather came from Syria. This is typical of Brazil. We mix everything. It's common you have Arab work in Jewish hospital, Jewish work in Arabic hospitals, and it's a mess. This is a large hospital. We have a lot of units around Brazil. This is the medical faculty, and Albert Einstein have 22,000 employees, including medical staff, nursing, everything. And the reason why we begin to study spirituality at the hospital is just because we begin to have cases of suicide between the employees during to stress medical life, stress everything. And this moved us to begin to study it and to begin to have a pathway for action, and not for the employees, but also for the patients. So when you go to hospital, you don't go alone. You go with your history, you go with your past, you go with all that makes you a human being, including spirituality, including religion. And as doctors, we can't exclude, we can separate it from the general care that we provide to the patients. So this is the reason why we decided to study it and decide to have a team in the hospital. Nowadays, we have three subgroups, one making research, one making education, and one making care for the patients. Okay. For centuries, physicians and healers, religion, spirituality, and health came together. And many years ago, there is a clear relationship with the sacred, with the spiritual and health. For the patients, it's important just because he discovers strength in the spirituality. And it's a deep connection with friends and with family, and through communities and practice. However, modern days, the clinicians, that they overlook the dimension of spirituality when considering the health of others, or even themselves. The problem is that medicine is a religion itself. We have rules, we have guidelines, we have practices, and sometimes we must keep it on this. And it's difficult to live from this track. But neglect this history of linking health and religion. In most cultures, we have a lot of evidences that we are increasing to individualize it in the patient-centered care. The objective is when the patient comes to hospital, understand the beliefs, understand the spiritual life, help us to help the patients. Just because sometimes we can bring someone of the religion community to help us to treat the patient, to convince about the treatment. And sometimes the spiritual leader of the belief of that patient help us to cope with the disease, to make a better sense about what is happening and why is happening this with that patient. So, according to Gallup, this is not recent data, it's 2060, about 89% of the population of the United States believes in God. And 75% consider a religion of considerable importance. This is the data of World Valley Survey, as you can see. That point is working. Let's see which is interesting. This is how much religion is important for you. Very important, really important, don't know, no answer. And you see China, India, United States, and Brazil. As you see, in China, it's very, very less important. For Chinese, religion is not important. For India, it's almost part of everything, as you know. I don't know if you know the Indian, the customs of India, Ayurveda, and etc. They really live the spirituality. Even in the United States, you see that elderly population, they consider very important. The younger, a little bit less. In Brazil is a religion country. So this kind of data you find in many countries. It's a very good site to explore. They have a lot of information about that, the World Valley. So what's really the definition of religion and spirituality? What is really it means to be religious and what it means to be spirituality? This is important when you study. This is important if you want to make a design of a study. Just because religion, it's the search of meaning that occurs within the context of established institutions with rituals and belief through which you will contact the divine. If you want to tell with God, in religion terms, you must follow the rules. You must do strictly what the religion tells us to do. Spirituality is a more open concept. Spirituality is a dynamic and intrinsic aspect of humanity. It's grow up with us as human beings since the early times, and through which people seek the ultimate meaning, purpose, and transcendence, and experience relationships. This is important. Self, family, others, and community. Spirituality is relation with yourself and another one. And the meaningful of sacred. Spirituality is expressed through beliefs, values, tradition, and practices. There is no fixed rules. Each one decides the way that he wants to talk with God. If you want to walk around, if you want to run, if you want to meditate, if you want to make a yoga, you decide. You have the way to take with God. If you were well succeed, probably will find a religion and you'll have a lot of followers. But other way, you do it alone at your home. This is called private practice. Okay? That's fine? Are you understand me? Yes. Okay. Well, and let's show you some data. I don't want to be very medical on this point, but it's important to show you this kind of data just because they are large studies and publish it in very good journal. For example, this is a JAMA Psychiatry, Journal of American Medical Association. This researcher, Van der Velde, is a researcher for Harvard, and he is also a statistician. And he evaluated the association between religion service attendance and suicide from 1996 through 2010. He studied about 9,000 women during this period. And as a good statistician, he cleaned up all the data. All the population he set up with the same levels of depression, diseases, physical state. So he taken out all the confounding variables. He just fixed it on this question: attendance to religious service. Why? Just is easy to ask. It's quickly. Everybody answer quickly. And it's a very good data to study. And as you see, How frequent the patient, the woman goes to the service, less frequent is the suicide. And you see that there's a difference between Catholic and Protestant, just because in the beginning he was thinking that the Catholics was protective than Protestants against suicide, but this is not the center of the study. The center is this. Among this woman who participates in Earth Health has studied that attending religious service once per week or more was associated with approximately 5-fold lower rates of suicide. So goes to church, goes to synagogue, goes to wherever you want, is protective against suicide. And we have a more impressive data from the same author. But at this time, it was published in JAMA, General Clinician, not JAMA Psychiatry. The impact of this journal is very high in medical association. And what he studied, attendance at religious service was assessed from the first questionnaire in 1992 through 2012. At this case, 74,000 women. And the analysis, among this time, 30,000 women dead. And he did the same question. How frequent you goes to the religious service, and what he observed. After multivariable adjustment for major lifestyles, risk factor, attendance at religious service in 1992 was associated with 33 lower of all-cause mortality compared to women who never attended religious service. And I have the opportunity to meet Van der Waal personally. And we and other colleagues asked him about the data. How did it? And really, as a statistician, he shows that he really equilibrated all the variables. Obesity, lifestyle, alcohol. So he excluded all the confounding variables. This is a very impressive study. Well, let's move on. Okay, so everybody's taking a life during a horizontal life, working, wake up, breakfast, work, lunch, breakfast, dinner, go home, sleep, and all the day in a horizontal life. Then a crazy man made this. What happened with the American population in September 11? Many of them turned to pray, religion, and belief. When things like this happen, all of us begin to our nature, and our nature is to pray. Okay? In Brazil, we have a joke. When you are with a patient and prescribe antibiotics, I will say, you will feel better, the patient, if God wants. And when he gets better, I told you you're going to get better, just because God wanted. Our practice was nothing. And what happens when you live in a secular society, like many countries in Europe and in the United States, and something happens with you? You have diagnosis with cancer, for example. This study was very interesting just because it's a study made with retirement in Europe. This is called SHARE. It's a longitudinal data for people of 50 years or more. What he tried to figure out in this study, when you live in a secular society, and when that happens, a crisis, you begin to pray, you go to church, you go to synagogue, you go everywhere. But the final result, if you have no growing up in a spirituality environment, the final result you may understand as depression, suicide, is not so good as if you internalize these values since you were a child or since earlier. in terms increases if you are not, if you haven't this value inside of you. Perhaps begins to pray, it's good. Perhaps to go to church, it's good also. But if you have no inside of you this value, in the end, it's not so good as if you have these values inside of you. Okay, this was published in the European Journal of Epidemiology in 2017. Okay? Well, and let's show you some difficulties of data, just because it's not everything is never so clear. And this is the most prominent researcher in spirituality and religions is Koenig from Virginia. He studied religion and depression. In fact, religion participation has been associated with lower depression rates in numerous studies. Okay, that's fine. But 272 cross-section of studies published since 2000, 63% suggested a protective association, only 6 detrimental. 45 cohort studies since 2000, 47% suggested a protective association, only 11% detrimental. Okay, you tell me it's a larger evidence. I trust that religion protects against depression, but it's not completely true. Just because perhaps some evidence from the observational studies, the vast majority are cross-sectional. This is a problem, which is a cross-sectional study. Cross-sectional study when you have a population and say, okay, in this population, I will make one question, and for me, it's not important if you are depressed or not. I just gonna be a question. It's a very weak design to have conclusions. And this is one of the problems of studying religion and spirituality. It's difficult to find a study design, a longitudinal study design. We have not so many. And this researcher, Masalko, in 2012, examined using longitudinal data for affect the reverse direction. They show that among women, depression at the age of 18 predicts lower server attendance, controlling baseline. This is a evidence of a reverse causation. Why? If you are depressed, you don't leave home, so you don't go to the service. So it's difficult to find this conclusion. So you can't find an association just because there is no reason for a girl for 8 years old to leave homes to go to the service. She's depressive.
Sorry, Dr. Nasri, could you speak more loudly for the people at the back?
Okay, I speak lower. I have difficulty to speak higher, but I will try. Even if there is no effect on service attendance and depression, we would find a protective association, simply because who became depressed stopped attending. Well, more about religion and depression. Even when well-designed large longitudinal studies with baseline control for depression, this is very, very good studies, they in fact suggest the effect. This is a very good researcher, Stobridge, in 2001. He made a longitudinal study. Longitudinal studies is when you fix a baseline and tell, okay, we will follow you for 5, 6. In Albert Einstein, we are beginning a longitudinal studies with women with breast cancer. When they have the detection of breast cancer, make the surgery or the treatment, we ask at 0 time about the religion practice, what they trust, what they don't trust. And we are following this woman. We have with 4 years of following, and probably in the next year we will publish it. This is a longitudinal study. This is a good study. And unfortunately, we have not so many to have a final conclusion. But the analysis make clear that cross-sectional are weak. But in fact, we have some protective effect of religion and spirituality and depression. And anxiety. Anxiety also is difficult to measure. Koenig again report that religion involvement is related to less anxiety in the majority of studies, or no relation. In this case, unlike depression and suicide, it's not clear the evidences. Longitudinal studies suggest really we have a protective effect again. And a meta-analysis measured the effects of 90,000 participants, and also we have a protective effect. But it's not general. And imagine us, a woman, not married, who got a child. And he goes to the church or whatever, and perhaps she gets anxious just because they criticize. What gonna think about me? I am a single woman who have a child, not married. And this is an anxiety factor. This may generate anxiety. So it depends. It depends on the roles of the church, of the community, of religious communities, just because many of us, we are afraid to be judged, and we are afraid to express what we think. Now we are in the era of transgenic, of changing sexes. How it will be accepted in many, many religions. So perhaps in this case, attend a religious service must be a generator of anxiety and not a protector. Okay? So this is why it's difficult to study it. But we have a lot of other outcomes. Stobart again and many other studies published data about all-cause mortality, religion protecting of all-cause mortality, life satisfaction, minimum purpose, less substance abuse, this is very important, less crime, social relationship, marital stability, and generosity, volunteering, civic engagement. So we have a lot of publications with a lot of fields, not only with depression, suicide, or anxiety. And about mental health. We have an increase in positive feelings such as meaning, purpose, connection, well-being, peace, hope, but also we have negative feelings such as bitterness, desire for revenge, and fear. Pargament is a very important researcher. He's a psychologist in the United States. He is a very important, he studies struggles, religion struggles. And these two factors can influence many studies that compromise mental health, such as depression, anxiety, and happiness, drug, and the stress. Well, as you see, we may have an idea that spiritual and religious can have a positive impact on several physical illnesses. Positive association of spirituality and religion and survival, the reviews I told you, but it depends on the type of religiosity. It may be associated with positive or negative results. Pargament study conflicts, struggles, associated with religiosity. And I will show later, but this question, I asked myself if God have abandoned me. This kind of feeling, I am being punished. God don't like me. He's associated with worst results in health. Just because this kind of feeling make people abandon treatment, forgot, skip treatments, skip cancer treatment, for example. And this question, God's love me, at the beginning of the study, we have a predictive of a higher risk of a mortality in 2 years. And the conflicts. It's very important, this. Spiritual religion conflicts have been negatively associated with mental health and physical health outcomes. Here we have a lot of studies against parliament with older population. The high religious conflict scores were predictive of great mortality. In elderly, which is my specialty, it's very important. Just because in the end of life, you must think what happened with you, the actions you did, what you didn't forgive, and everything else. And if you are not solved, if you are not clear for you, this have a heavy impact in the end of life. Okay. Which mechanisms may happen in our body to this kind of results? Happens something in our body. If I'm religious, if I go to pray, this is results in something good in myself. Yes. Health behaviors. Most religion affiliations do not recommend drinking alcohol, discourage smoking, not allow the use of illicit drugs, generally encouraging health behavior. In fact, when you attend, you have general good rules in behavior. Coping, I will tell you, coping encourage positive coping with situations. I will tell you in a few minutes. And you have social support. When you are in a community, you have friends, you have, sometimes you have medication, you have food, you have another benefits. You make charity, which is very important. And we have also another markers that you may use to explain the benefits of religion and spirituality. This is very important. This is the interleukin 6, which is a marker of a good aging process. Aging well is aging less inflamed. And interleukin 6 is a marker of inflammation. And we have studies measuring the levels of interleukin 6 in elderly patients and showing that the high level of spirituality, the low level of interleukin 6, which is very important. And also we have cortisol. Attending the meetings of religion meetings, practicing spirituality, you have low levels of cortisol, which is help us aging well and avoid diseases. Perhaps is one of the mechanisms. But the use of religion beliefs and behaviors facilitate problem solving, prevent, alleviate negative emotional consequences of the stress, and help the medical team. When you have some patients that don't want to take pills, they avoid the treatments, some time of the team we will recognize the risk and they will ask him, what is happening with you? Do you need help? And sometimes we may provide a visit of religion, of leader of that belief. Well, what is religion and spirituality coping? The coping is search of meaning, take control, give a spiritual comfort, life transformation, spiritual growth and knowledge. This is why coping tells us. And we have two kinds of coping. Religious coping, the positive and negative. When you have negative coping, we ask, why God abandoned me? Why I've been doubting God's powers to interfere? And God can't help me. I have been punished. I delegate to God the resolution of the problem. I don't deserve this disease. So God give me this disease, God will save me. This is a negative coping. And this is the health results are worst in this kind of beliefs. But when you have a positive coping, seek spiritual support, trying to understand what the disease is, what had happened to me. What may I learn in this process? May I help the medical team? May I help God? May I help work with God? You are not feel sick. The results are better. The work of medical team at the hospital is identify negative coping and transform it in positive coping. Easy, no? Okay. And we have the strategies of coping. Self-direction. It's a good. Active and perceive God as the one who gives freedom and means for the subject to take the control of their life. Delegation. This is passive, it's not good. Waiting to God to solve the problems. Collaboration. Both God and I will learn with this process. And supplication, praise to God, trying to influence Him to solve the problem. This is good, and this is the red one. They are not good. And in the end of life, in a multi-site perspective, 343 patients with advanced cancer. Those whose medical teams, clinicians, chaplains, nurses, everybody, attend to the spiritual needs of the patient. This patient suffering of cancer had a quality of life scores at life end that were 28% greater, more than average, than who didn't have the spiritual care. So it's important that the medical team, the medical staff is involved to understand the spiritual needs of the patient. But otherwise, in contrast, when religion communities supply the spiritual care in the absence of medical team, this patient have lower odds of receiving hospice service, higher odds of receiving aggressive medical intervention. So when the medical team do not understand the spiritual needs and the social support, the religion community is not integrated in the medical care, in the end of life, who suffer is the patient, just because the doctors tend to be more aggressive. Okay? So this is important to work together, the clinicians, the patient, and the chaplain. Okay, but I told you about the goals to attending the service. What happens there? What's so good? Well, what happens is this: spiritual support, material support, you have community, volunteer, charity. This is very good. Sorry. But it's not only this. You pray. It's important to pray. Have any difference? Yes, do have. When you pray, we activate the parasympathetic system, which decrease our heart frequency, decrease our blood pressure. We increase oxytocin, which is a hormone that helps us understand another one. Increase melatonin, and we have all these benefits. This is published. If I tell you all the evidence, I will talk all the night about the evidences. But this is a very interesting study published by the Italian group. What they made, they asked the patients spontaneous breathing, tell a mantra, and pray Ave Maria. Ave Maria, Mary. I'm sorry. And what happens with the circulation of blood in the brain, of the rhythm of the heart? You see, everything, every measure getting better. Only praying Ave Maria. But the temple is inside of you, and you may reach this state of connected with the sacred or divine. Yoga, meditation, painting, running, swimming. You will find your way. The important is to get connected. This is a very interesting study about this is a meta-analysis. Which is a meta-analysis? A meta-analysis is when you have a large number of studies and you try to put it all together in one conclusion. This researcher, Rosansky, made a meta-analysis about purpose of life and mortality of all causes of cardiovascular events. We have 10 studies with 136,000 participants. And the conclusion is that sense of purpose is protected against mortality. And the religion and the spirituality give the sense of purpose for us. This is one of the benefits of religion and spirituality. Anger and hostility predicts the development of atrial fibrillation. Atrial fibrillation is a common arrhythmia which is associated with poor quality of life and death. And anger and hostility, it's very interesting. Also, the association of anger and hostility with future coronary heart disease. This is a meta-analysis. You see, anger and hostility have been associated with a higher number of acute coronary events in healthy population. This study is published in the American College of Cardiology in 2009. And this is a very interesting, this is one of my prefers. Telomeres are structures that are found in the termination of chromosome. When we age, the chromosome is open and the DNA is right, and then he closes again, and they happen all the days. In the end, the length of telomeres as a marker of aging. We don't use it in medical practice, but use it in studies, in clinical studies. And this is a British studies. Measuring the length of telomeres in hostility. This is the man with high hostility and low hostility. And you see that if you have low hostility, your telomeres are larger. You are younger. So the tip of the day, be good, even it's for selfness. That's fine. Okay. I am ending this first part, okay? But this is very important just because this is new, also in JAMA. This is a group called Delphi Group, Delphi Panel. It's really, as I told you, difficult to find a final solution about religion and spirituality just because the nature of the population, nature of the studies of religion and spirituality. So this group, with a group of specialized doctors which studied this theme, this issue, they analyzed this number of studies. They separated 371. And after looking for all the data, he ranked 3 top implications of evidences of spirituality and serious illness. First one, incorporate spiritual care into care for patients with serious illness. Incorporate spiritual care education into training of interdisciplinary teams caring for persons with serious illness. Include especially practitioners of spiritual care in the case of patients with serious illness. This is a special of guidelines. This is a special of recommendation for clinical service. This is really new, and for sure it will be a large time to be implemented. Also, the same group studying the larger number of studies made the same process, and they decided that incorporate patient-centered and evidence-based approach regarding the association of spiritual communities with improved patient and population health outcomes, increase awareness among health professionals of evidence for protective health association of spiritual community. This is really new. 2022, also in JAMA. Well, I will begin this first part with a clinical case. This is a case which we attended at the Medical University of Sao Paulo in the psychiatry division. This is a patient with 81 years old. She's a spiritist and attends the meditation group. She's widowed for 15 years. She currently lives with a caregiver. She's a beginning of dementia states. And was engaged, and she was in the past engaged with a Poly student. Poly is engineering university in Sao Paulo. It's a very famous engineering course, engineering. And this student was murdered during the military dictatorship, which happens in Brazil in 1967, 1963. She wants to be a doctor, and she was really in love with this boy. And when he died, she decided to don't be a doctor. She studied biology, and he didn't finish the course. She married with a friend. He had since he was a child, he had a son and a daughter. Her father committed suicide. She have a good life, a good life. She have not complaints about life. But in the end, she talks to God and doesn't pray to any saint. Everyone thought I would overcome it, but I want to be able to handle the loss. It was a spiritual that helped me. Okay, if you read it, you think, okay, this woman's fine. She had no conflict. You will see in the end. Sometimes when you have a trauma, a heavy trauma, you can talk about it. There is no way to talk about it. You have to express in another way. So we decided to submit some patients to mandalas. We have 6 sections of mandalas, 1 per week. And before each section, we conduct a meditation. And the mandala is a blank piece of paper, nothing at all, only a circle. The patient chooses the color, chooses what to want to do. And this lady used light blue drawings. The conducting the study, with a friend of mine, suppressed the blue from the options. And when she was looking at the color, where is the blue? And she gave the blue. And the blue have many significance. Kandinsky is the colors that says the colors that produce a vibration of the soul. In fact, there is a lot of meanings for blue, since Ave Maria or celestial color. We are looking for reasons for the blue. But in the end, she drew the last mandala. She drew this mandala. I don't know if you see. It's a circle with a lot of stripes here, converging to a center. This is the last mandala. And at this mandala, we ask him to visualize a sacred garden. What do you like to have in the garden? What's sacred for you? Visualize an encounter with a being of life. And during this visualization, she becomes very emotional. She cries. The being of light who comes to meet her was his boyfriend, who was murdered in his youth. She says that for a long, long time she didn't really remember what does his face look like. And during the exercise, she saw him walking toward her. It was a very emotional meeting and explosion of life. It was 50 years ago, and I have not felt this way. I'd like to thank him and all the spirituality that helped heal the heart and brought other concepts to continue life. My garden was allowed and came toward me. And this mandala, there is a special of guidelines of mandala, which a psychologist called Kellogg, Swiss, from Jung. She gives concepts or trying to explain what kind of mandalas is for. And this design is similar to the Kellogg explanation. And the Kellogg explanation is 10 stars. Portals of death begin in the entropy of life, the cycle. Death and rebirth. End of a cycle. They represent the death of obsolete conscious content and the pain of change. Midlife crisis is typical of stage 10. Task to reevaluate life goals, abandon outdated ideas about who we are, and the end of pain and abandonment. And to conclude, in the beginning of the study, we apply this scale of spiritual diary experiences. It's in Portuguese, I'm sorry, but here, when you take this is never, nevermore, and this is frequently, always. And this is, I feel the presence of God, I feel a connection with God or the sacred. In fact, this questions is about the relation with the sacred. In the beginning of the study, he was very far from God. And after the experience, she changed completely. We transform a negative coping in a positive coping. Okay, this is the first part.